everyone, Dr. Luqman here, welcoming you back to the Catster YouTube channel. And today we're going to be continuing our senior pet cat care series. Now, for those of you who are new, we are doing a series on care tips for your senior cat. If you have a senior cat, if your cat is turning into a senior this year, or if you plan on adopting a senior cat, then this video is for you. If you haven't checked out our previous videos, make sure you do that. And as always, this is your friendly reminder to please do hit that subscribe button. Please do leave us a like, and of course, we welcome your comments. Now, in today's video, we're going to be focusing on things you should be paying very close attention to with regards to your senior cat in the home. The first of these is actually your cat's litter box habits. Now, this is in fact true for cats of all ages, but with seniors in particular, you have to be very careful and very mindful of their litter box habits, because slight subtle changes in their litter box habits could actually indicate that there is a problem with your cat's health. Now, this can be anything from like missing the litter box, urinating less frequently, urinating more frequently, defecating less frequently, defecating more frequently, yowling in pain when they're trying to defecate or urinate, or having a very, very turgid or very firm stomach to the touch. You should also be mindful of any point where your cat misses the litter box, as in they end up eliminating somewhere else other than the litter box. Is there a ghost in my house? Because my light just changed color, you guys. Like, I'm serious. Does anyone know what causes this? Hi, Dr. Luqman here. Why is this thing going blue? Unholy spirits or demons or anything in my house, blue light, ghosts, I banish thee, be gone. Okay, now where was I? Back to cats, please. Keeping on top of your cat's litter box routines is actually a very good way for any responsible pet owner to know when there's something off with their cats. Now, keep in mind that if your cat does have litter box issues, or if they're missing the litter box, or if they are acting really strange while they are using the litter box, it doesn't necessarily mean that they have a UTI, as in a urinary tract infection. It doesn't also necessarily mean that they have constipation. Like, it doesn't have to be linked to the elimination process itself. There are many other diseases and ailments that can impact your cat's elimination habits. And this is inclusive to just about every organ system within the body. So if you have a senior pet and you notice that their litter box habits are changing, you might want to take them to the vet. Now, this brings me to our second point for today, which is general behavioral changes. This is something that is often not caught in senior cats. It's actually not even that well caught in adult cats, because many people tend to associate idiosyncrasies with regards to a behavioral change as the cat being quirky, or the cat, just showing off their personality, when there are times that a personality change or a behavior change is actually due to an underlying health issue. Now, the behavior changes that you should be mindful of include the aforementioned litter box issues, but in addition to that, you should be mindful of things like your cat randomly pressing their head on a wall, your cat randomly circling around in either direction, almost without any rhyme or reason, your cat suddenly yowling in really obscure ways and for no particular reason, your cat just generally vocalizing more, your cat isolating themselves and hiding, your cat refusing to eat, that is a very, very important sign, and your cat not being as lovable as they used to be, or your cat actually lashing out at you, hissing at you, kicking you, or trying to escape when you are cuddling with them. Now, all these are telltale signs that something might be going on that requires further investigation. All these are telltale signs that your cat might actually need to have a further examination. Which brings me to my next point, which is your routine welfare visits to the veterinarian. Now, for most healthy adult cats, we actually recommend that they be taken into the vet at least once a year to make sure that everything is fine, and usually to update any vaccinations that need to be updated. But for senior cats, we actually recommend that you do this at least twice a year. Now, please keep in mind that this twice a year actually means that if your cat is a healthy senior with no underlying health issues, then you should be seeing a vet at least twice a year to make sure that everything is fine. And the reason we recommend twice a year is because age can be a predisposing factor for some ailments in cats, And the earlier something is caught, the better the odds of treating it successfully and in a more time-efficient manner. So this is why we actually recommend having your senior cat looked over every 6 months by a veterinarian in lieu of every 12 months. However, if your senior cat does have an ailment, does have a diagnosis, or does have a health condition, or if you feel like they have a health condition, then they do need to see the veterinarian more frequently than the 6-month interval. So once again, I would like to emphasize that the 6-month interval is actually for a healthy cat that's a senior, that has no underlying health issues, and does not have an upcoming appointment or does not have a reason to be seen by the vet. Like they're injury-free, they're healthy, there are no significant changes in their routine, and they seem to be doing just fine. So in that circumstance, yes, as a senior pet, they would have to go into the vet every 6 months, but if there is something wrong, they would have to go to the vet more frequently. As always, this is me, Dr. Luqman, reminding you to please do hit that subscribe button, leave us a like and a comment, and I will catch you on part 4 of this series the next time. Bye guys! There are many other diseases. What is that? No, and this is inclusive of just about every sorry. I was like limited to, that makes no sense. Okay. And that's it for part 3 of our 4-part series. And that's it for what is serious? Oh my goodness.